Omar Abdel-Mannan, who is in London as well. He's the co-founder of Health Workers for Palestine. Doctor, again, great to have you here with us on TRT World. So we were discussing the plight of civilians in Gaza, the ones who have been trapped in areas like Rafah, trying to flee to Beit al-Pala. Now, the biggest problem in those areas is that healthcare facilities are not working. Even the ones which are working are only partially working. They're only able to operate their emergency rooms, as I was discussing it with Nizar Sadawi earlier in the news hour. As a doctor yourself, what do you think we are looking at if fuel is not provided to hospitals, if they continue to not work at their full capacity? What future do you think awaits is waiting for Gazans who are there?
I think the situation, as I said, was catastrophic. I think what we are heading towards is what we saw in November. And this was a time when, hospitals were running out of fuel. The intensive care units were not able to provide ventilators for their patients. We saw patients dying in their droves because of lack of hospital care that was provided, especially for patients with chronic diseases. And we are back at this scenario. The only difference is now we are 40,000 deaths into this 6 months of this conflict. And we are at a situation where many of these patients are acutely, if not chronically, malnutrition. So the mortality rate from this lack of capacity within hospital systems is going to take things to a new level. We already saw reports from the London School of Tropical Medicine suggesting that mortality rates, projecting them to go up to the hundreds of thousands in a escalation scenario. And we are in that escalation scenario now. We're in a situation where Rafah is being attacked, just as the Israelis promised they would do. They said they would be going into Rafah, and the world has sat back idly and watched 33 hospitals being made dysfunctional or non-functioning. They have watched as patients and doctors and healthcare workers have been targeted systematically. We have over 500 health workers that have been killed so far. And the situation is just getting worse by the day and by the minute. And frankly, my colleagues in the European Gaza hospital for some of the NGOs who are working there this morning were sending us videos where it was completely pitch black. It was pitch black because they had run out and the generators were kicking in to provide some sort of semblance of, lighting or care in the operating theaters. But the reality is, these Gazan hospitals are about to go completely dark.
And Doctor, over the past 6 months, we have been discussing this. Over the past 6 months, we have been getting this warning again and again that Gaza's healthcare system is on the brink of collapse. But I think now it's fair to say that it has collapsed in many ways. The hospitals which are working right now are only partially operational. For example, their emergency rooms are working to treat those who have been injured. Can you just describe us that process? What are you hearing from your sources, the ones who are treating patients right now in Gaza?
Well, what we are hearing is, as you said, in the emergency department, they are absolutely overflowing with patients. And you have to remember there are tens of thousands of internally displaced people who are also staying in these hostels, which makes the bed situation a massive issue for them. But what we are seeing is, continuous influx of women, children, men with horrific injuries, many of whom are succumbing to these injuries because of the lack of triage, because there are not enough personnel to be able to, decide which patients need to be seen straight away and which can wait. And on top of that, the doctors themselves have been working constantly throughout this. They are now, in fact, the foreign doctors who are inside are now stuck. There is no evacuation or no route to allow other doctors to come in and take the burden of the currently, doctors inside these hospitals. So what I'm hearing from the ground is an increasingly grim and very concerning situation. And meanwhile, Israel continues to escalate the situation. It continues to stop any humanitarian aid from coming in. We are days into now, a complete siege and blockade. Before we had a few hundred trucks coming in a day. Now we have absolutely nothing. And this is compounding an already crumbling healthcare system. And I envisage, what we are going to see is tens of thousands of civilians succumbing to their injuries, to malnutrition, to infections. Our own colleagues in some of these hospitals are, getting diarrheal illnesses. They are unwell with fever. And these are folk who have only been, in this situation for a few days. So what about the hundreds of thousands of civilians and people that are there in that situation for months on end?
Dr. Omar Abdel-Mannan, thanks very much for talking to us here on TRT World. Really appreciate your taking out the time.